Hi guys, Dr. Orna here. Today I went and did something that I have been putting off for a while. I went and got basic screening blood work. So I also got a tie-dyed Band-Aid because the place I go is super cool. And I wanted to take this opportunity to talk a little bit about preventive screening labs. As a naturopathic doctor, this is something that I like to do with all of my patients. We usually do it after the first or the second visit to kind of get a baseline. I always review people's older labs if they have some that aren't super old, just to get a sense of where people are and so we can track changes. I consider this part of basic wellness. It's like taking your car in to get the oil changed and just like have them do the however many point check they do. It's good to just get a sense of where we are. But also just the basic labs that most doctors run, naturopaths, allopathic doctors, just like super basic screening blood work, can give us a lot of information about health and progression toward health or away from health. So the standard tests that people usually get from their annual physicals, whether it's done by a naturopath or not, are things like a complete blood count, which tells us about immune status and tells us about any potential for anemia, a comprehensive metabolic panel, which tells us about liver function and kidney function, and to some extent about markers that influence the heart, and signs about pre-diabetes, a cholesterol panel. Cholesterol is this huge controversial topic, and I'll talk about that in depth in another video. But just looking at where somebody's cholesterol is, and not even the cholesterol numbers, but the triglycerides and the HDL, can give us deeper information than just the superficial numbers. I also like to test a bunch of other things, including thyroid function, vitamin D. There's a test called the hemoglobin A1C that gives you sort of an average blood sugar reading. And all of this just tells us where somebody is and gives us hints if people are starting to go in a not so good direction. I've been putting it off for myself, partly because, these times I'm trying to stay out of places with other people as much as possible, but also because I'm afraid of needles. And I just want to say I had an amazing draw today. I don't do blood draws in my office when I have, my office open. Right now I'm doing just telemedicine, as I think you all know. I usually send people out. Getting a good blood draw is so nice because it is a thing that a lot of people get scared about, and it can be done in a way that is really literally nearly painless, and that was my experience today. Plus tie-dye Band-Aid, right? So I will do a blog post very soon outlining the standard tests that I order. And I just want to say that this is part of self-care, and also that knowledge is power. As we go into the upcoming seasons and all of the uncertainty that's coming to us, I wanted to go in with as much information as possible so that if something is kind of off balance, I can find it, see it, correct it, with the help of, my doctor, because doctors also need doctors. So I just want to encourage you, if it's been a while since you've done lab testing, talk to your doctor and see about getting some stuff done sooner rather than later so that we go into the fall with the best knowledge so that we can be as safe as possible. Thank you so much for joining me. I hope you like I'm really excited about my tie-dyed Band-Aid. In my office, I use bacon Band-Aids and pickle Band-Aids. It's fun. You should have a pretty Band-Aid, even if you're an adult, right? So I hope that this is useful to you. And if you have any questions about standard labs and what they tell us, please do let me know. Please do like, share, subscribe, follow, comment, save if you find this useful. And I hope you stay safe and stay well. Bye.